Good day, everybody. Gary and I are back for another update. A lot happening, but one thing that's happening is it's beautiful outside. It's 65 degrees today, so get out and enjoy the sunshine. I want to start with an announcement first. Dr. Jeff Silvers, who is system-level infectious disease expert, who is programming a lot of the information that funnels down to us, has a webinar tomorrow from noon till 1, where he's just going over issues COVID, giving everybody an update. I will send that link out to you, and so you have the opportunity tomorrow to do that. Obviously, for all of you who've been following us, it'll simply be a review. But if you want to try to learn something, you can tune in to Jeff. Okay?
Jeff's a really good speaker.
Good, good. All right, so let's get to our first slide. Where are we at with epidemiology? Virtually nothing new to add. This is stuff you already know, but as you can see, there's a hint of a minor deceleration at the tip of this, not significant. So, Gary, I noticed that you wrote an article for the Gazette titled Silver Linings. Please explain yourself.
So, first of all, Happy New Year, everybody. And I think that in the new year, we're going to have some silver linings with this Omicron variant. Clearly, this variant is disruptive, no doubt about it. But we know a few things. So I'm going to kind of boil this down to you for a slide that's going to be somewhat helpful. What do we know about the Omicron variant? Yes, it's more contagious. It has an R number about 7. In a Dutch study, household secondary attack rates or infection rates was just as higher in vaccinated versus unvaccinated people. So having the vaccine is helpful to preventing severe infection, but you can still have a lot of contagiousness with it. That's how contagious this virus is, but it is less severe. And that's an important point. For the very first time in this pandemic, we have a dominant variant that is less severe. We haven't seen that with Alpha. We didn't see that in Brazil. We didn't see that with the Delta strain. This is the very first time, and that's going to be important because evolutionarily, I think we're turning the corner. Okay. We're becoming more endemic. We also know that there's less viral replication in the lower respiratory tree, and so there's less inflammation, fewer pneumonias. People who are unvaccinated and vaccinated. Our hospitalization rate is low. We have, 9 cases in the hospital. I had 3 in the ICU last week. No one in the ICU under my service this week, nice. Which is really good. And 99% of people hospitalized are still unvaccinated. So the old paradigm that it's dangerous to be unvaccinated still stands for the Omicron variant, but it's not quite as dangerous as a Delta strain. More testing is being done. So we're doing more testing with kids going back to college, people traveling more, indoor gatherings, big events. With more testing, we're going to see more cases. And there's going to be a bump in cases, but it's oftentimes mild and asymptomatic. So that's a good thing. But it also, get to put it in perspective, more cases doesn't mean more illness. Small rise in hospitalizations locally. South Africa had a very rapid spike and a very quick drop, and I think that's what we're going to see in the US. And I think after this incredibly disruptive surge, we're going to have more herd immunity. So vaccinated people and unvaccinated people who are getting infected are going to get a bump in immunity, and I think we're going to get a better local herd immunity at the end of this. So the tail of this is going to be a good thing, even though it's disruptive now. So those are kind of the silver linings. I really like this slide. This slide the next slide came out of the New York Times. I kind of pointed out here that first bump is the Delta surge. And if you track cases and hospitalizations and deaths, it tracks along the Delta surge, which shows it's a more virulent virus. But look at the Omicron surge. There is this rapid uptick in cases. This is the highest peak of cases, even worse than last year. But our hospitalization rate is not as bad. And so even though there's a big surge in cases, asymptomatic mild cases, hospitalization rates are lower, and the death rate is even lower than in the Delta surge. So this is good in the way of severity, but it doesn't mean it's not disruptive. And just a final slide to show you, because we always look at data, we always look at epi curves, and we're not just sort of talking out of our hat, that this is what happened in Africa. And I pointed out the Omicron surge to the right. In South Africa, you can see that they had a very rapid uptick in cases, and it dropped very quickly. And their hospitalization rate was just a bump. It didn't track this to that degree, so that's a very good sign. Good. So I think 2022 is going to be a better year.
Different topic, because we were receiving questions and seeing in the newspaper about pediatric hospitalization. So is there an actual increase in the prevalence of severe disease in pediatric age?
Yeah, so we are getting questions about pediatrics, and it is in the news, you're right about that. And so I put together something from the American Academy of Pediatrics. So this just came out January 6th. For the American Academy of Pediatrics, they're tracking in 24 states and in New York City, how's it going in pediatrics? And they did see a bump. Between December 3rd and January 6th, children represented 17% of weekly reported cases. But again, remember, it's a 12% increase, but we're testing kids going to school.
Yeah.
So we have more testing ability. If you test more people, you're going to find more cases. The question is, in the last two ones, are kids being hospitalized more, and are kids dying of this more? So the hospitalization rate for pediatrics is 1.7 to 4.3 of total COVID hospitalization. So less than 5%, 1 to 4% of hospitalizations for COVID represent children. And if you look at that the other way around, 0.1 to 1.6 of all COVID cases in children result in hospitalization. So that's a pretty low number. So I think what you're seeing is that there are more children getting to hospitals because there's a bigger denominator. Yeah. We're seeing a bigger cohort of kids, and as soon as you send kids to school, some kids are going to get sick. In the influenza season, we see the same thing. We see when influenza goes through a school or a daycare, many children get infected and some children get severely ill in every age group. And I think that's what's happening with the Omicron strain. Not much different than the flu. But what we know about children is that, remember, children don't have as much of a receptor expressed in the nose. So they don't have as much receptor to pick up virus. And with the Omicron strain being less in the lower respiratory tree, we don't expect kids to be a cohort.
So it's reassuring.
Right, and the mortality rate in children is very, very low. So this is data from the American Academy of Pediatrics, very reassuring. It still means we need to vaccinate children, otherwise we won't develop herd immunity as quickly.
Okay. I'm going to switch gears from the epidemiology and talk. This has been going for a long time, and it's very clear it's having an impact on us providers as individuals, as our community. And I just made a realization when I came back after the New Year's. So I took an extended, longer weekend for Christmas and New Year's. And when I came back, I realized I had a little more joy in my work. I had a little more desire, a little more motivation to do the tasks that I normally do, which made me realize in retrospect, prior to that, I was tired. I was feeling a little more morose, a little more sullen, and I felt overwhelmed all the time. And the lesson to me was, I didn't realize it, but it was really impacting me. I only realized it in retrospect. How's your energy holding up? Because you're in a different environment than I'm in.
Yeah, so I think, same day folks, ER stuff, primary care, myself in the hospital, ER workers, what I'm noticing is that in the population, in our patients, and in our coworkers on the front line, I think everyone is clearly exhausted. Everyone's tired.
Yeah.
And then the next level of being tired is being exhausted. Yeah. But actually what I'm noticing now is I'm noticing that some of us are really depleted. And so I actually took some time off over the Christmas break as well, Gary, and I just wasn't recovering. I mean, I was sleeping in, I was hanging out, I was being mellow, but I wasn't bouncing back. And what I noticed that emotionally, I just didn't have as much joy. And I think that is where you kind of get this depleted state. I think about that, and I talked to a good colleague of mine who's a psychologist, and there's something called compassion fatigue. And I really think that layered on the difficulties of medicine, we have this element of compassion fatigue. I imagine that's what the firefighters felt in 2017. They had these historic fires, and they just wouldn't go out. And there wasn't just one of them, there were 17 of them. And they went burning and burning, and I imagine that they just couldn't get their arms around that. And that's kind of what this feels like with every surge, every news flash, every change in CDC recommendations. And so I think there is an element of compassion fatigue here. And I think that's remarkable because the compassion fatigue, if you're not careful on an emotional level, feels like it's very isolating. When I was on vacation, I kind of felt emotionally isolated from my family. It was harder to engage with them. And I think that's really a danger in not connecting with one another.
Isolation is huge. I was thinking about this the other day. When we interview a lot of applicants every week, maybe 3 or 4, and I always make a point of talking to them about what makes us a little bit unique. We're small, but we're a close-knit group, and by that I mean we make a very deliberate and conscious effort to create a social network for our providers. So we have many opportunities to socialize. We give everybody each other's cell phone numbers. We try to bring some fun into the practice of medicine, because we all know that lacking that, if you're just coming to work, you're sitting in front of your computer, you're going to your patients and going home, that doesn't feed the soul that needs being part of something and feeling some joy. And what's happened is that's the exact environment we've created. So we're telling people to stay away from other people, to avoid gatherings, don't get together. We've canceled all of our meetings. We were even telling people when you eat your lunch, go do it alone. That is a difficult environment to live in and to function in.
Right, so public health recommendations only supports that isolation experience.
Yeah.
It sounds like.
Yeah.
Yeah, I think that's really tough, because I think that sense of isolation can be really tough on a lot of us when we're just struggling with patient frustration, patients being depleted, our colleagues being depleted. And I think in the element of compassion fatigue, some of the recommendations that we give one another is, to not just to take care of yourself, but to maintain that connectedness as best you can.
Yeah, and I think we have to point out that we're talking about how we feel in this pandemic. We have to realize that when you're seeing patients, every individual sitting across from you is feeling the exact same thing, and they're coming asking for help for it. And so it's really taxing on our providers at that level. In terms of the compassion, another example I had in my clinical experiences, just last week I went in, a person came with a fever. I always look up prior to going in to see if they've been vaccinated. And so the flag goes up, unvaccinated, 30-year-old male. And I go into the room, and I don't like to go there, but I find myself falling into this trap of essentially blaming them, or having these thoughts in my mind about if only, or that kind of thing. And it's so easy to fall into that trap, and then you get agitated, and it becomes antagonistic, and it's a failed communication.
Right.
And so what I've learned now is I have to stop outside the door before I knock, take a deep breath, remember why I'm going in this room, and to take it as it is. So what have you found about that? You're in a very, very much more significant and severe environment when it comes to that.
Yeah, so I imagine, when I'm in the ER, in the ICU, and I meet someone, and 99% are unvaccinated, it's kind of a given in the hospital.
Yeah.
When they have bad pneumonia. I actually had a patient who said she was vaccinated, and a week later on high flow oxygen told me that it wasn't. And I just knew, looking at the CT scan, this is an unvaccinated person. But the hard part is the easy place to go is you get frustrated, and you get a little bit angry, and then you realize, well, what I realize is I take a step back and I'm like, wow, those really strong emotions, that's my stuff. This patient doesn't feel my strong emotions. I have these strong emotions. Yeah. They're not causing this. This is kind of bubbling up for me, and I kind of have to own that. So that emotion towards that person, that's my stuff. They already feel guilty. They're ashamed. They feel horrible, and they don't know if they're going to live. So they already have this enormous burden of their own emotional stuff, and it's important that I don't, transfer my stuff on them. So when I take a step back, there's two ways I look at this. I can either fix this in my head or fix this in my heart. In my head, I'm like, work harder, push harder, be there longer, right and wrong, justice. If I take that sort of ego dynamic head mode, it doesn't offer much healing to me or to the patient. Right. But if I take a step back and say, whoa, these really strong feelings are coming up for me, what's going on here? That's when I realize on vacation, ooh, I am toasted. Yeah. I am more than exhausted. I'm really depleted. And what I realize is it's going to take a little bit longer to fill that tank. It's not going to take one vacation or one weekend or one day off. And it's going to take a lot of little things like connecting with my colleagues. And one thing I've noticed, Gary, is that if I kind of share with other people how I'm feeling, it helps a lot. Now sometimes that's, like your family, my wife, my kids, and sometimes it's with our colleagues. So as an example, I met Laura Black as a super user, and we developed a little bit of a friendship. And now when I bump into Laura Black at different committees and with different questions on Epic or staff messages, we'll just say, hey, how's it going? How are you doing? And sharing with someone how you're really feeling, even if it's a bad day, is really nice, because it shows your vulnerability and it connects you to them when you're feeling emotionally isolated. Now, I will say that sharing is different from complaining, because when you share with someone, you're kind of open with your heart and you're letting them know, wow, I'm kind of having a bad day, or things aren't great. It doesn't have to be about work. Sometimes it's kids, traffic, whatever. But if you complain all the time, what happens is you put yourself in this really bad headspace. It drags you down and it drags the people around you. So something that Laura and I may say is like, wow, today was a really tough day, either at work, at home, or whatever.
Yeah.
But what we don't say is, oh, that's Steve Mitnick, he hasn't fixed this yet, And so that's a complaining thing. So I think that's really important because it's easy to complain and develop that negative sort of arena.
Yeah.
But the other parts of it are, taking care of yourself on the time off.
Thanks for not using me in that example. You and I are different. I'm more introverted, so that's not the first place I would go to, is sharing so forth. So I've found more coping by, I'm sleeping more. I'm really trying to exercise on a very regular basis. And I find myself reading more novels. At bedtime, when I go to bed to turn my brain off, I'm reading books. And so that's helped me a lot. But I'm always trying to share more. That's a challenge. I wanted to let everybody else know that there's help out there. Hopefully you're able to share your feelings with each other in the group. That's what we're here for. But in my next slide, I want you to know that there are resources. I'm going to show you 3 different things. The first one is to know that your insurance, Aetna, does have a navigation program because it can be hard to maneuver through the behavioral health system. So that slide gives you a phone number you can call and get a navigator on your side. The next slide is about fast access, and these are things I've showed you before. This is if you feel like you need psychiatric consultation, which is equally hard to find, but this is a fast access, a service that one Sutter psychiatrist is providing via his office. There's a phone number there, you get right in, you get hooked up with somebody immediately. The particulars are on the slide. And then the last thing for everybody you should know about is our employee assistance program. So this last slide talks about that. It's free, it's quick. There's an 800 phone number you can call and you can talk to a therapist right now, and you get up to 6 visits for that, and that can then lead into some further help along the line via Aetna. So hopefully those resources are useful for you. Keep these slides out where you can find them, because when you need it, you need it. So
yeah, I think the last thing I'd like to say, Gary, is that I think it's really normal for us all to be completely toasted right now, and to realize that all of us are feeling this, patients, staff, one another, and it's okay to feel that way. This is, if you're not feeling completely toasted, maybe you're
in denial.
You're not in Sonoma County. So just to know that.
Yeah. All right, thanks everybody. Hope this is helpful.